So, just to summarize, in patients with GI dysfunction, and again, we need to take, of course, each case individually. Most of these patients will have one or other type of inadequate GI functionality. They may have dysmotility, they may have diarrhea, they may have constipation. This is not a reason to withhold fiber, it's a reason to give it. Both insoluble and soluble fiber combinations will help in most situations to regulate consistency, to regulate motility, to regulate fecal flow. Patients with GI dysfunction will have, as we all know, some varying degree of altered integrity of gastrointestinal mucosa, of increased permeability, and so on and so forth. This is not a reason to withhold fiber, it's a reason to give it. Insoluble and soluble fiber combinations, particularly if we can use prebiotic combinations that help modulate intestinal flora, will actually be beneficial for trophism and integrity and permeability of the mucosa, for a few of the reasons that we mentioned earlier. And finally, we know that patients with GI dysfunction, whether it's because we're using drugs, antibiotics, whether it's because they're in the wrong environment, whether it's because we kept them in PO for too long, all of them will have altered intestinal microbiota. This, again, is a reason to give fiber. It's not a reason not to. In other words, it is very interesting that our myths until now have led us to this use of the so-called elemental diets so that we can deliver everything we want to our patients who have GI dysfunction. We've left out a very critical element. This is, of course, and should never be taken as a blanket recommendation, and you should individualize the management of each one of your patients. But for the most part, we can understand and find very few, if hardly any, rational, well-controlled information to argue for the exclusion of a functional ingredient that is so important for gut function and integrity, in this case fiber, but we can find a lot of reasons for inclusion in the diet of these patients. Next slide. In pediatric management of gastrointestinal dysfunction, fiber, and specifically certain fiber and prebiotic types of fibers, are an important part of maintaining gut health, and they're a major adjunct in managing their GI compromise. I will stop there, and I think hopefully we have time for questions.
Thank you, Dr. Saavedra, for an excellent presentation. I actually have a question for you. I'm wondering if there's any disease or condition where insoluble fiber would be strictly contraindicated in the pediatric patient.
There's no absolute contraindication for the use of, for that matter, any soluble fiber or any particular fiber that has been shown to have a prebiotic or so-called bifidogenic effect. Any side effect or adverse effect that you get from any soluble fiber, whether it be a prebiotic or other forms of soluble fiber, are strictly going to be dependent on the dose. Fermentable fibers, like any other fermentable carbohydrate, are going to lead to fermentation and the production of water, gas, and short-chain fatty acids. For the most part, we do want a gradual and persistent production of water and short-chain fatty acids in most of the patients where we know have altered flora, where we know have altered motility. However, if that fermentation or amount of water produced is too high, then we will have the common side effects that we see for anybody who has any type of carbohydrate malabsorption. No different than when you give too much lactose to a patient that malabsorbs lactose. If you give too much of a particular prebiotic fiber, or the rate at which you give it is very high, you're going to have a larger amount of water production, you're going to have a larger amount of short-chain fatty acids, and you can get or lead to the potential occurrence of loose stools and increased gas. In this case, again, most of the signs or symptoms obviously are going to be evident. And from this point of view, it is important to make these decisions based on an individual case-by-case basis. The fact is that for the most part, in most individuals that do not have very severe dysmotility, or individuals that have very severe bacterial overgrowth, for example, adding a prebiotic, if anything, may modulate their flora, especially if you give it in the diet. And the last comment I should make is that there is a difference between giving fibers, and let's use fructooligosaccharides, which is a type of prebiotic soluble fiber which increases the amount of bifidobacteria and can decrease the amount of other bacteria in the stool of pediatric patients. It is in general much better to give this fiber as part of the enteral feeding than to give it as a supplement. I'm many times asked, should I just be adding this as a dose, give them a dose of pectin or give them a dose of fructooligosaccharides or so on and so forth. And the analogy I would use there is lactose malabsorption. If you give the same amount of lactose to a patient who has low lactase levels as a supplement versus if you give it as part of their diet, you're going to have significantly less symptoms, and you're still going to get the potential benefits of having some added carbohydrate if you give it as part of the feeding, in the feeding, and distribute it over a period of time, rather than if you give it as a bolus or if you give it as a single supplement.